Hello and welcome and good evening and assalamu alaikum to everyone who is watching this video. Viewers, this is Dr. Muhammad Yasin and you are watching my YouTube channel. Viewers, today I want to talk about something which you might have seen in the news, or people who are following coronavirus. You might have read this news, or you have heard about the news that many of the European countries, first they halted the vaccine, AstraZeneca Oxford vaccine in their countries, and then obviously they restarted it with some restrictions. Obviously there are some age restrictions. Some countries are giving it only to above 50 or above 60, and even UK they decided to give it to only above 30. So then why they did that? Obviously in simple terms, this was because of the blood clotting. So there is cerebral vein thrombosis or thromboembolism. This was happening in some patients. Some patients were reported as getting this after the vaccine. So that was the reason many of the European countries, as a precautionary measure, they did that. So many of my friends requested me to make a video on that in detail. But obviously I was not sure that there was a proper data published, or any study at a bigger scale was not published to have conclusive evidence that I would share with you. So I don't share any videos or any information unless I am convinced with some information. So that's why I was waiting for a bigger level study that will be published, and then I can talk to you about this. So now a study is published by Oxford University. So what they did a retrospective cohort study. So obviously this is retrospective, not a prospective study. They did not follow people who had the vaccine. They went back and they collected the data based on the health records. So they checked the health records, mainly the US people, and because they have more health records electronically available. But it was not USA only, the other countries also, including UK. So they looked at the data, and what they looked at the information 2 weeks after either getting the disease or getting the vaccine. So what did they do? They looked at the patients who got COVID-19 disease. So they included almost 500,000 patients. So they took the record of more than 500,000 patients who had COVID-19 infection, and then they collected data of influenza, people who got influenza or flu infection. So they were almost 170,000 cases. So what did they do? They looked at, after 2 weeks after the infection, they looked at if they had any CVT. So what is CVT? CVT is cerebral vein thrombosis. That means the vein that supplies blood to the brain. And they looked at the clots in those veins, so it's called CVT. They also looked at the PVT. Now the previous data or previous information that was available, nobody looked at PVT or portal vein thrombosis. What is portal vein thrombosis? Portal vein thrombosis is the thrombosis or clotting of the vein that supplies blood to the liver. So in this study, they looked at both the CVT and the PVT. So CVT is cerebral vein thrombosis and PVT is the liver portal vein thrombosis. So they looked at the two set of patients who had disease, COVID-19 and influenza. So the patients who had COVID-19 and 2 weeks after getting the infection, the incidence of CVT was 39 per million patients. So this was CVT in patients who had COVID-19. And the PVT was more than 426 almost cases had PVT. And the influenza, they looked at CVT. The CVT was 0. So no patient who had influenza developed a CVT after that. But the PVT, they had almost 98 of them, 98 per million. So the people who had influenza, 98 per million developed the PVT. So this was the disease. Then we look at the vaccine related events. So they looked at the vaccine, they looked at Pfizer, BioNtech. So people who got Pfizer, BioNtech vaccine, And now they looked at those people who got the vaccine, and the vaccine was the people they followed was almost 500,000, so 490,000 almost cases. So people who got the vaccine, they looked at again 2 weeks preceding the vaccine. So 2 weeks after the vaccine, they looked at their records and found out if they had that blood clot. So they looked at CVT. So the CVT incidence was 4.1 per million people who got the vaccine, and the PVT was almost 44.9 per million people who got vaccine. So this was the comparison. So what did they do? They looked at AstraZeneca. Now the limitation here was that AstraZeneca, they did not do their own study or looked at the data directly, but they took the data from the European Medicine Agency, who already looked at the incidence, and that tells us that they had 5 per million CVT after getting the AstraZeneca Oxford vaccine. And the PVT after AstraZeneca Oxford vaccine, the incidence was 1.6 per million. Now I will just summarize to you the comparison. When we look at the CVT, after getting COVID-19 infection, it's 39 per million. After getting influenza or flu, it is 0, no CVT. And after AstraZeneca vaccine or Oxford University, the AstraZeneca vaccine, it is 5 per million. And after getting Pfizer BioNtech vaccine, it is 4.1 per million. So if you compare all this, after getting the disease, the chances or the incidence of CVT was almost 8 or 10 times more than people who had the vaccine. So the difference between AstraZeneca and Pfizer was not too much. It is 4.1 after Pfizer and 5 after AstraZeneca or the Oxford AstraZeneca vaccine. Now we look at the PVT. So the incidence of PVT after getting COVID-19 infection was more than 400 per million cases. After getting influenza, it was 98 per million. After getting Pfizer BioNtech vaccine, it was 45, almost 45 per million. And after getting AstraZeneca, Oxford AstraZeneca vaccine, it was 1.6 per million. So if you compare all this, so if you compare AstraZeneca with Pfizer, AstraZeneca 1.6, Pfizer 45. If you compare to the diseases, COVID-19 more than 400, influenza 98, less than 100. This is all the comparison. Now you might be thinking, why portal vein thrombosis? Why are we even looking at that? Maybe it's not a serious condition. The CVT is a serious condition. It is the veins that supply blood to the brain. So that is very serious condition, and the mortality will be very high. That's why there's no need to look at the PVT. But actually, when they look at the mortality after CVT was 20%. So for example, if the total events were 20, so 4 of them and then died, unfortunately. So the mortality was 20%, and the mortality of PVT was 18.8%. So it is not a very significant difference. Okay, when they looked at the general population, that without a vaccine or without COVID-19 condition, when they looked at general population, again, some people were talking about the incidence of portal vein thrombosis or cerebral vein thrombosis is very high in the population anyway, so there is no problem with getting the vaccines. But actually this has been proven with this study that in the population, they looked at the population. In that 2 weeks, they looked at the population wise, and they looked at what was the incidence of this CVT. The incidence of CVT was only 0.41 per million. So this is much less than with the vaccine or with the disease. Again, that theory is not acceptable, that it happens anyway, so there is no problem with getting the vaccine or the disease. So it is now proven that there is a link. There is causal association. Previously, there was no evidence, and people were not accepting that the vaccines or the disease can cause this condition. They were always talking about not causal relation, that it may be something else, but it's not directly related. Okay, viewers, this was just a summary of the study. If you want to read the whole information, this article, I will put the link in the description. It's almost 23 pages document, so you can look at the complete detail. But I just summarized for you. And I hope you like this video. If you like this video, and please share it with anybody you know. And please subscribe to the channel if you haven't done so. And take care of yourself, take care of people around you. Assalamu alaikum wa rahmatullahi wa barakatuh.